Hi, welcome. Wonderful. I'm seeing people come in. Welcome, welcome. It's great to see some familiar names here and some new names. Thank you so much for joining us. We are so excited to be here both in honor of Mother's Day coming up and Mental Health Awareness Month in May. Um, we are so happy that you joined us. Thank you. We are going to chat. I have these amazing expert guests here with us today. We will chat for about the first half of the hour, and then we will open up the conversation to questions. So please think about what you want to know. We have incredible resources here with us today. My name is Hannah Howard. I am the editor-in-chief at ParentCo. I'm also the mom of a 4-year-old and a 6-year-old. And at ParentCo, we are really proud to be connecting a global village of parents, supporting parents in all different stages of their journey, but especially as they become parents for their first time, which is the theme of this talk, what we wish we knew when we were before we were parents. Very hard to share. I feel like we oftentimes resort to cliches. So we're going to try to be real and honest and offer whatever insight and wisdom we can. Um, I'm going to do a very quick introduction of our two experts and then let them talk a little bit more about who they are, what they do, and why they do it. So we have here with us Dr. Catherine Birndorf, who is the co-founder, CEO, and medical director at the Motherhood Center, who we are really excited to be collaborating with at ParentCo, which is based in New York. And she has just a wealth of experience and knowledge, and I'm going to let her go into more details about who she is and what she does. And we have Courtney Zentz, who's also we're really proud to collaborate with her at ParentCo as well. She's an award-winning speaker, author, and the founder of Tiny Transitions, where she offers sleep expertise to parents at all different stages of their parenthood journeys. So why don't we start with you, Catherine? Tell us just a little bit more about yourself and how you came to be doing the very important work that you do.
You, Hannah and Courtney, and it's really nice to be here this Maternal Mental Health Month, mental health awareness, all these things. So I am a psychiatrist, but I am also a reproductive psychiatrist. So everything from menses to menopause, and the perinatal period is in between. It's that big section in between. And I was the person in med school who couldn't decide between OBGYN and psychiatry. But so I married them from a psychiatric perspective, and I deal with all the emotional issues along the reproductive spectrum. But at this point in my career, 10 years ago, I opened the Motherhood Center in New York City. And it really is, in a way, the culmination of a lot of the different things I've done. But it is a place where we treat perinatal mood and anxiety disorders. So we are treating women and birthing people who have struggled with anxiety, depression, OCD, PTSD, complex PTSD, all different kinds of trauma, birth trauma, bipolar disorder, and postpartum psychosis. So we treat all the way. We treat it all. And we're a brick and mortar center, and we have a nursery on site, and we teach lactation and sleep, and we help with all those things in addition to really fundamentally diagnosing and treating whatever someone's presenting with, both on the milder spectrum in our outpatient department and all the way up to our day program where people come every day of the week. They go home and sleep, but it's the highest level of care outside of a hospital. So we really keep mom and baby together. And so that we can really think of, work on attachment and help people, feel better faster, as we say. And the only other thing I'll say, because it's so relevant to this conversation, and I realized that I'm sitting next to my bookshelf, that I wrote a book, which is sort of like this title, What No One Tells You. And I have to read the subtitle, A Guide to Your Emotions from Pregnancy to Motherhood. So this was a book written in 2019 with a colleague of mine, which is really, as a reproductive psychiatrist, talking about how we help. It's like the emotional what to expect, right? And it's pretty evergreen, and I think it's a pretty good read, very accessible. And no, it's not even a plug, but I hope it helps And, it's sort of like the title of this conversation. So I thought I'd pull it out.
Yes, and so many amazing resources
Yeah.
for parents. So thank you, and thank you for joining us. Courtney, tell us a little bit about you. Tell us about tiny transitions.
Yes, thank you so much for having me. I appreciate being here today. My name's Courtney Zentz. I founded Tiny Transitions in 2014, honestly, out of a place where many of you might be shortly, which was coming home from the hospital with my first son and going, wow, there's really no village. I didn't have that support. And you sort of strap baby in at the hospital and they go, good luck. See you later. Much like Dr. Catherine was talking about, I struggled from a variety of different things that I didn't recognize at the time. Postpartum anxiety. I had a bit of intrusive thoughts, which I'm sure we're going to talk about. And I really thought, my gosh, there is really no support. And I think being chronically exhausted really played into it. And also this false sense of like, I have to nurse perfectly and run the perfect house and run the perfect company while I'm on maternity leave with, my corporate employer at the time. And I really saw a gap in the space for non-clinical support of new parents, which then slowly evolved into, infants and toddlers. So my predominant focus is sleep. I'm also a lactation counselor and a trained postpartum doula, but I focus on sleep because that really is the foundation for which the house is built. And so I have a great team. We bring a variety of different backgrounds and specialties. I have Carolyn in Boise, Idaho, who's an ENT and was an RN or an ENT RN for over 25 years. I have Chris, who's the only male sleep coach in the entire country. He's been with me for 6 years. And Kylie, who is a pediatric occupational therapist and also works on the team as a sleep coach. She works predominantly with toddlers. So we try to bring differentiation in accessible support to new parents and current parents at all ages and stages and really make sleep accessible to everyone. There's so many different ways that we try to help families through the work we do because we believe everybody deserves the gift of a good night of sleep. So I'm excited to be here and help as much as I can with bringing baby home and feeling good and supported. So
Amazing. We're going to just kind of jump right into the heart of it with questions because we don't have tons of time and we want to get all of the good stuff we can. So this speaks right to your book, Catherine, and I think a lot to your work, Courtney. What's something that you wish more first-time parents would understand before the baby arrives that maybe they're not hearing from their friends or from professionals?
It's funny. I was just meeting with a patient, and she's got a 3-year-old and a almost newborn, a couple months old. And she said to me, "I thought I could get so much done on this maternity leave, and I'm like, just all I can do is be with the baby." And I thought, brilliant, right? That's like I was thinking about the talk, right? That maternity leave is or time after the baby is not time off. It is anything but. It's a new job. And so I really think there's so much more to say about that, but I'll just answer it quickly that way. But also, you are just meeting this person that you birthed for the first time. And there's a lot of like, I should know what to do. I should be in love. I should feel competent. And that is just not true. So I want to just give everyone permission to be a mess because it is just not. I mean, the amount of pressure we put on ourselves to know it, do it, love it is ridiculous. And I
yeah.
wish I knew that.
And I was going to say, I think there's this false sense of expectation, like you're going to come home because I was very similar. I had a team of 40 and I was like, I'm going to be on maternity leave and I'm going to run my company and do all this stuff. And I got home and I was like, boom, wow, this is really not going as easily as I thought. So I think from my perspective, it's give yourself grace to learn everything that your newborn needs, whether it's your first or your next, they are different. Right. And what you did with the first is going to be different than what worked with the second or what might work. And I try to explain to parents, like, look at what you can control in the situation and try to have some kind of management of that, if you will. And then of all the variables, give yourself grace on those and know that, it's okay to ask for help. It's okay to seek support. But if you don't have it, it's okay to just prioritize getting to know that baby and doing what you have to at that point to nurture that relationship, if you will, and they need to feed and they need to sleep, and then everything else around the house kind of gets sorted. But your mental health and your own balance too is important. So
Amazing. I feel like you both, I was going to ask next about this gap between expectations and reality, but I think you both already answered that. And I think I too, I think, and a lot of new parents I've talked to had this experience generally feeling like a confident person, very competent in the world. And that can really get challenged when there's a new baby and your world is really turned upside down, which I think is a great bridge to this next question about like what's happening when I mean, we know that there's a new human in the world, in your family, in your home. What's happening psychologically during that early transition, and any tips for us about just kind of what to expect?
Well, I want to go back for one quick second and add the discrepancy, the delta between expectations and reality to me is the measure of distress,
Mm.
right? So the greater that is, the greater the distress. So I like to think about that with patients sometimes, and I'll do this because, like, if you expect nothing and you get nothing, right, right. But if you expect a ton and to be doing it perfectly and you're feeling like a mess, the level of distress just grows. So I really think expectations, and that's why I like talking about this now. And you're having two people, Courtney and myself, reflect back. And I'll just share one personal story, which was, with my kids, I was a resident when my first daughter was born, and we barely got any time off. And even with the 8 weeks that I was allotted, because I had a C-section with my first child, and I I went back at 7 weeks because I did not know what to do. I knew how to be a doctor, but I did not know how to be a mother. And I was dumbfounded. And I'm like a really fairly competent person. I knew how to babysit. I knew how to do things. I wanted this kid. I had a pretty easy pregnancy, and I didn't know where I was. I was orbiting, and I went back to work early, which I regret. I mean, I feel sad about. Anyhow, so I just think that some of the gaps there, like this myth of knowing everything, is just so important. And I just sorry, I wanted to emphasize that again. But to your question, the change psychologically, and I'm curious what Courtney says, but to me, it's the identity shift. Period.
Mhm.
It is like that your body just I know I say it, it's kind of weird to say it this way, like you made a human. A human came out of you. Like I still, it's like a miracle and it's wild. And that's not, I mean, I know it's like routine and we all do it kind of thing sometimes. Yeah, but it's a big deal. It's a big deal. And your identity is really impacted. And it's not just a gain or a loss, it is both.
Yes.
So I think we can talk more about that, but it's a big shift. And to me, that's the biggest thing.
And I think to your
Yeah.
point, it is this balance of management of the exhaustion, which you're going to feel, right? With the hormones that are all over the place, with, oh, and now I have this responsibility for a tiny human and I'm putting the weight of the world on myself. And I think to your point, I was very similar. I wanted this child so badly. And we were very blessed to be able to have an easy pregnancy but I went back to work at 12 weeks. And sometimes I was excited to go back to work because I was very type A. I knew my team, I knew my day. I could drop them at daycare, pick them up at 5, see you later, here's some bottles, I'll pump every 3 hours. And I could control that, right? Coming home postpartum, I didn't expect the lack of control. And as somebody who's a very planned person who takes pride in my organization and such, like you cannot have that be real. It's just not realistic. And you have to accept that because I think to your point, the delta of, expectation versus reality. For me, I was like, oh, I'm going to be great at this. I will tell you, for me, parenting was the only job I felt like for the first 6 months, I sucked at it. And it's a very real conversation because if you can accept it, right, you can then fix it. And it took me with the second child to be a little bit more like, okay, I'm prepared for this. But with the first, not to scare anyone, but it's just real expectations, right? Like I couldn't wait to go back to work at 12 weeks. And my husband and I at 8 weeks, I remember getting into a bit of a conversation about it because he'd come home from work and go to the gym and be like, how are you? What can I do? And I couldn't wait to just be like, here's Max, peace, And I was like, gosh, that's not how I'm supposed to feel as a mother. I'm supposed to want to be here all the time and do all the things and sacrifice. But I was almost resentful of my husband for having not changed much when I was becoming this whole new person. I think that identity shift was big for me, right? So I think psychologically, as mothers, we have a lot more going on, where um, I was much like you on, on the 12 weeks, I was like, bye, see ya, pick you up at 5:30, and for me, that felt like I could control it. And I think to a degree, I'm a person who enjoys working. So I didn't want to stay home. I know that's not the case for everyone, but for me, I'm a better mom because I'm working. Um, and so I just, accepting that and understanding that every person's going to have different perspectives on that as well. Your expectations are fundamentally going to shift when you become a parent. So.
You have no
Yeah.
choice.
Yeah.
Let's talk a little bit more about that identity shift that you both touched on, because I think that's so fascinating. And I love what you said, Catherine, about like both losing some part of yourself and gaining a new part of ourselves. So I just love to hear more about that. I mean, that felt really big to me, that change of I was in my 30s when I had my first kid. I was a person, I felt like a person in the world for a long time with a very strong sense of self. And then that got really shaken. So I'd love to hear more about how you navigate that and how you recommend navigating that.
Yeah. I think for the three of us on this screen, we are similar. And I don't think this is true for everybody. But I think that whether you're a working person or not, you might have expected that like you were going to be a stay-at-home mom if you have that privilege and you could do it, and it is not what you expected. So it's just you can't know. And you could have been babysitter extraordinaire, best aunt in town, know read everything. You can't know until it happens. So I think some of it is, to me, the name of the game is flexibility and adaptability. It's like and a lot of us, like you described, Courtney, being like type A. I'm actually not even type A. I'm like type B minus, B plus. I just, even though I'm a medicine, I'm not that I'm a little, I'm a little whatever, and I don't need to control everything. And I still couldn't gain any competency. I just didn't know what to do. And the shift in my identity, again, like being a doctor, I knew, but mom, I wanted, but I didn't even know what it meant. So I think it's like you're not, I guess that's what I say is like, you're not supposed to know what your identity is right away. You're in transition. And I think that's why I'm so psyched, by the way, that the word matrescence has got a whole new lease on life. And that's a word, in the field I've known forever. And I work closely with Orly Athan, who helped repopularize it. And it's just, it's one of my favorite words because for those of you who don't know, it's matrescence is like adolescence. It's becoming an adolescent or becoming a mother. And I always think it's not an actual developmental stage because not everybody does it. So, everybody has to go through adolescence to get to adulthood. I mean, as conceptually, psychologically, but not everybody has to become a mother. So, we don't talk about it, but it's kind of a developmental stage. And I think like you get 9 months or 10, but by dates, to be pregnant. Like I needed those months to like get my head around that. And like all of a sudden there's that liminal moment between babies inside and then babies outside. And all of a sudden now you're a mother. I mean, you're still a mother if you're pregnant, right? Because there's a lot to say about that too, in terms of what could happen and what does happen. But that moment, all of a sudden, I'm a mom. Really? Like now I have a new badge, like it's a new part of my identity. I don't even know what the heck it means. So I really think it takes time. You have to learn, and the identity of it is emerging. I mean, I still have, when I hang out with my kids now and they say things to me and we remember, things about when they were young, it's like, I'm still like learning. I'm still becoming a mom. I'm still rewriting the narrative and reconceptualizing my identity. And, it's an ever evolving transition. But I do think it's quite distinct in the beginning with those expectations of like, you should know what you're doing. And that's just not true.
Yes, I love it. And I love that you use the word of the transition, and that's in Courtney's business's name, and it does feel like this constant process of evolving and learning and growing and changing. And yeah, just right, it's always in flux. I love that. Um, I wanted to jump into the topic of sleep, but Courtney, did you have anything else you wanted to add about identity, or should we just go, okay, let's talk about sleep, because we all know that being exhausted comes with a newborn. It can be so intense. I don't think I could have foreseen that. Tell us a little bit more about sleep. What can sleep deprivation do to us in terms of our brains, our mood, our ability to cope? Talk a little bit more about this very intense facet of new parent life.
Well, I think there is the perspective that for the next 18 years with a child, you're not going to sleep, right? It's just not the case. But I need people to have expectations that yes, a newborn does need to eat roughly every 3 hours. They need 24 to 32 ounces in a given 24-hour period for optimal growth, whether that's from the breast or bottle, that they need that intake. So it's fully expected that baby's going to wake at night to eat. And it's fully expected you're going to be tired, but you try to look at, again, what can you control in the situation? Because chronic sleep deprivation, you can't pour from an empty cup, and it can lead to, which I'll let Dr. Birndorf explain more, because it leads to an imbalance, right? Where you start to get into some of these other things that can cause problems, right? And so I'll stay in my lane as far as making sure that, a child is getting the right amount of sleep for themselves, because a overtired child doesn't eat as well. Sleep begets sleep, right? And they also need the intake. So if you have this child who's chronically overtired and then not eating well, then they're awake because they're hungry, then they're overtired, right? You can get into this sort of a hamster wheel that can spiral, and then it leads to you spiraling, right? And you get into a lot of the postpartum mood disorders that sleep, when you get it, can start to help balance, because everyone feels better when they're sleeping well. It is, just into your point, tiny transitions, right? I named my company that because it's tiny transitions into motherhood, tiny transitions back to work, tiny transitions maybe from nursing to bottle feeding, or from, you know, formula to nursing. Like, right, you make all these transitions these first years as a new parent, but sleep foundationally is what helps you to feel optimal from a growth standpoint, from a mental balance standpoint as a parent, and then also from when a baby grows. I kind of say your baby is recording all day when they're awake. And when they sleep, they're editing, and you need to have that time to edit, and so making sure there's as much balance in there as there can be, which I talk a lot about, but I'll let Catherine talk a little bit more about from the chronic sleep deprivation standpoint, like all of the imbalances it can cause, because that's what she's dealing with. A lot of it is triggered from a lack of sleep as well in her practice, I'm sure. So.
I love you say that very well. And, I often say sleep is medicine. And I used to, when we had prescription pads, I used to write sleep, RX, take this home, show this to your partner, show this to your family, that the doctor is saying you must sleep. And, if you're lucky enough to get 8 hours, I mean, that's a joke with a new baby, but the idea, or uninterrupted, but you should have, and Courtney, I'll defer to you. Like, I'm sure this is much of what you do, is how many chunks can you get? How do you eke those out? But we do know that with both acute and chronic sleep deprivation, you're affecting your health, body, mind, the whole thing holistically. So it's not just your mental health. People like I don't know, if you don't sleep for 72 hours, that you can become psychotic, that you can lose your mind, right? Like with everybody, that I think people go to, like, I'm going to lose my mind, right? And there's some truth to that, right? There is some truth to, like, true sleep deprivation over several days. It's a form of torture. And you do really physiologically and biologically become confused, paranoid, potentially psychotic, lose touch with reality. Fortunately, that's not what's happening with most people, though I will say that with illnesses, a lot of psychiatric illnesses are triggered by lack of sleep. So it is essential, and it's so paradoxical. Like, there's no time for sleep, but if you don't sleep, so you really must sleep, and figure out how to do that. Even, I mean, I'll let you talk about that, Courtney, some of the techniques and ways, but it really sets you up. You need to get some sleep in there. And not doing so can contribute to depression. It can make you more anxious. In cases where you either have bipolar illness, which is the old manic depression, bipolar illness, that it can precipitate the onset of it doesn't cause it, but it can trigger it. It can trigger psychosis. It can trigger lots of things. So it's not just that you don't feel good, you don't have any resilience, your coping skills are down, your executive functioning stinks, you can't remember anything, but you need it. The baby needs it for memory consolidation. It helps with all, immunity and different cognitive capacities and, immunologic capacities and cardiac health. And it affects everything. So it's not optional. Sleep's not optional, and you must figure it out one way or another. And again, I'll just go back to where I started. Sleep is medicine.
Yeah, absolutely. I mean, I think one of the best pieces of advice I give expecting parents that I work with is if you have a partner and if you don't, and you have a relative or a friend, right? One of the best things that I explain to families to do if you're both bottle feeding or if you're exclusively breastfeeding from the breast, but you're pumping, right? One of the things that you could do is go to bed right when the baby goes to bed at 7 o'clock. Put them down at 7 o'clock for the night. Okay. Now I say for the night. Yes, they're going to wake up to eat. Okay. Let me explain. If you can put baby down around 7 for the night, maybe you're pumping, so you go pump right after that. Take a shower, go to bed. Okay. Then your partner can stay up and wake baby if they're not awake at 10 o'clock for the next feeding because they're going to be up roughly around then to eat every 3 hours. And if you can go in, wake them, feed them a bottle, feed them an expressed bottle, and then put them back to bed. My husband and I did this and it worked very well. And it works a lot, very well for a lot of our patients is, they go to bed at 7:30 and then they take the first shift, right? So they sleep from like 7:30 to roughly around 1 or 2 in the morning. Their partner stays awake till 10, offers that feeding at 10, wakes baby, burps, feeds, puts them back. Then they sleep from like 10 to 6. You kind of get that stretch from 7 to about 1 or 2. You're both getting a chunk of about 6 hours. And then you're up the rest of the night, especially if you're nursing, you have to get the milk out, right? For a variety of reasons we don't have to get into today. But there's a balance to it though. And it gives you a chunk of 6 hours, them a chunk of 6 hours where you're both balancing each other out if you have the ability to do that. I get a lot of people that say, well, I wasn't told to pump yet, and there's going to be nipple confusion stuff. I've done this for 12 years. I will tell you that is not something I've seen more than maybe 5 times, if even that. Sleep is going to help you to have a better breastfeeding relationship. Okay. Sleep is going to help you to be more mentally balanced. And so if you can figure out a way to get those chunks in, you want to avoid a child sleeping all day and then being up all night, right? So you want to always make sure every 3 hours during the day you're offering baby a feed. They're even if you're waking them to eat, because that gets them the intake in the daytime hours where they can have a little bit of that longer kind of 4 or 5 hour stretch at night. There's usually one of those with a newborn, and then they're generally up every 3 hours. So if you can kind of manage it to that way, you can give yourself some balance. Again, always feeding a hungry baby, but I'm just saying, like, when you can balance sleep and intake, those are the two main recipes for helping you as well to get some more rest.
That's brilliant. My husband's going to be so happy when I tell him that you said that because we kind of came to that, after some very teary, terrible nights. It was like, you go to bed, I'll do the night shift. I got that first chunk of sleep. So I love that. This question, I intended it about sleep, but it could be about other aspects of early parenthood too. Like there's so much advice and noise, especially in this world of social media. Like there's 1 million pieces of this is what you should be doing. How do you filter that out and figure out what actually matters and where do you start and what is the good real stuff?
It is really hard, and the sleep industry is unregulated, right? Because the work that I do is in a non-clinical sleep capacity. If I notice that maybe a baby is mouth breathing or something, like I refer them out because that's a clinical challenge. There's something going on myofacially, right? So like I think understanding somebody's experience, their expertise, their certifications, and the education they have in the work they're doing, it is really hard to filter out the noise, especially in this day and age. And there's some things going on right now in the news that are really relevant to this because it's been a huge challenge for me as somebody who does this with evidence-based, work, that people are out there just spewing things that are not accurate, right? So I think looking for the sources of the information, everything I follow from a guideline standpoint comes from the American Academy of Sleep Medicine, the American Academy of Pediatrics, and citing those resources and showing people how you can control certain things. You're going to have positive and negative feedback no matter what you share, because it's going to be somebody's belief or somebody's perspective that this isn't the way we did it then. When you look at the science, you can break it down, right? Which is just how I've run my practice. And it helps in, I think, filtering out some of that noise, because it can be overwhelming, because you can have anybody whip up a nice Instagram page with paid ads and they're a sleep expert. And it's like, oh my gosh, like this is not the way I would handle it, So from our space standpoint, in the non-clinical aspect, it's a challenge because everybody can be an expert, and I think that's the hard part, but it's also because it's not clinical, it's more of an education deficiency. It's not really something that can be regulated. So it's such a fine line of something I wish they would regulate, because I've been kind of hoping for that for years. But, as a part of the APSC, which is the Association of Professional Sleep Consultants, like we're trying to re-standardize like who is in that, and the experience and expertise they have, because the space is just such a gray area right now.
Really interesting. I would sort of, well, I'll go a slightly different direction, and for a quote that sometimes is attributed to Roosevelt, but comparison is the thief of joy. I don't know if it's really his quote, but it is such a profoundly important thing to keep in mind when you're considering social media. I can't tell you how many patients come in and they bring their when they are being evaluated at the Motherhood Center, or they end up coming in, for treatment or whatever it is, and they will show me a picture and they'll say, "Do you see how good I look? I was suicidal." And I wouldn't tell anyone. I didn't show anyone. And suicidal, by the way, I'm sure that word evokes many things for many people, and it's very serious. And often in new motherhood or pregnancy, it is a wish to escape. And it is that wish to escape your life and like return the baby or not be pregnant. And that can happen when you're desiring this, and when you're not wanting to actively kill yourself, but you are thinking, why'd I do this? I don't want this. My life's ruined. My identity that I had space and time and a relationship, and now it's over, right? There's some really dark moments, even if there's no illness. Obviously, I'm going to flip now and say, if those feelings persist, if that really is a pervasive way one's feeling, or their ideas of like harm to self or harm to others, that's for real and has to be addressed, and we can help. But I do want to say that, it is not what it appears. You can't judge a book. Like, let's come up with we can say you can't judge a book by its cover. You don't know what you're seeing on social media. And we're doing so much better, than we used to. Like, I think of Scary Mommy when they first started, their platform, like just the idea, Scary Mommy, like brilliant. And then the stories that were told. And we did a documentary with them years ago when we opened, and it was kind of like, let's tell the damn truth. So, it just still, we're doing so much better, and more influencers and celebrities, who have big platforms, are trying to use them for the right reasons. But as much as there is, good truth and honest candor out there, there's still a lot of beautification and industrialization and commodification, like where you have to look good to sell your product, or to hide how you feel because you're so ashamed and you're so embarrassed and you're so sure that you're the only failure, the only failing mom. You got at least two. I'm not going to put you in the category, Hannah. Moms who were like, we thought we were failing for the first 6 months. Like I'm sure I looked fine. I'm sure I took care of patients just fine, right? Like, or well, even, but that's not how I felt. So that disconnect is so important, and social media doesn't help.
Yeah. I think that I love what you said, and that's part of the reason I'm so passionate about the work that we do at ParentCo, and why I'm a writer is because these stories that we have, when we share them, there's just so much power in that. And this feeling of loneliness is so real, and it can be so much just to be like, okay, I'm in this too. Just that beginning. And then, of course, this leads me to my last question, and then we'll open up to the questions in the chat. But I think based on this, like, okay, the story is a start, talking to our loved ones. When do we know we need to reach out for professional help? And then I'll kind of combine two questions. So when do we need to seek more serious help? And then also, if we are a spouse, a partner, or a loved one of a new parent, what can we do to support them? Courtney, you want to start this one?
Yeah, sure. So, first and foremost, my husband went back to work on day 2 of my son coming home. It was month end at eBay, and he was the controller. And they were like, "You got to close the books." So I was alone from day 2. And I love my husband. He is very much a very involved partner, and we are very balanced. But I was alone. My mom's dead, and I had no village. So I sat with a baby going, "What am I doing? I don't know what I'm doing. This is crazy." And my husband was not there, you know? And so I think I had postpartum anxiety, as I talked about, and I had intrusive thoughts. And I thought I was crazy. I thought if I go in the kitchen and I want to cut strawberries, but I drop the knife and it ricochets and then I cut Max's foot off, okay, don't go in the kitchen. And I wouldn't drive over a bridge in Conshohocken where I live for 5 years. I actually just drove over it for the first time since moving out of Conshohocken about a month ago. And I remember like kind of looking out the window, like, okay, I can look over the sides of the bridge now, because for a while I was like, what if I just jerk the wheel? Not that I would do it, but I thought about it. What if I just jerk the wheel and my car goes off? Or what if I accidentally get a flat tire and my car goes off and Max is in the car? And, it's like all these things in your mind where you're like, you're crazy, But I didn't want to tell anybody that because I was like, they're going to take my kid. Right. And so I think there is a reality to these things, whereas a person who felt pretty good going into this, right? I called my girlfriend and I was like, what the heck is this? And she's the only one I would talk about. I wouldn't even talk about it with my husband. And she's like, you got to talk to somebody, because I didn't even recognize that something was wrong. And I think that was the hardest part for me because I was embarrassed. It was triggering. I wouldn't stay in a hotel. I would travel for work. I'd be in Vegas and I would close and lock the balcony door because I was like, what if I just jump? And holy crap, right? Like their thoughts as like a competent woman that I was having. And I was like, I can't. Okay. So I'd request the lowest floor. I would not stay in hotels with balconies. Like, I mean, it was just to the point where like I had to manage it for a couple years to get over it. And I'm fine now. But like when you go through having a kid, like there's reality to this, guys. Like it's not, again, meant to be scary, but it's like sometimes you need somebody to tell you that it's okay to call for help. And I did. Sometimes you don't have anybody and you have to recognize, which I'll let Dr. Catherine explain how to best do, because you have to recognize, like, I am happy to talk about all of this publicly, and I do, because I think so many people don't, and they live this insta perfect life, and that's not the reality. You're coming home with an ice diaper on and milk shooting out of your nipples. You got all kinds of shit happening, and it's just a mess. And it's okay to be like, I'm a mess, like I'm a hot mess, you know? But it's a balance to that, and accepting that, like, it'll be okay, and like try to find that village of one person at least that you have as a confidant, because it wasn't my husband because I was embarrassed, so it was my friend who had a baby. And then she's like, dude, you got to like get this sorted, and then I did talk to my husband eventually, you know what I mean? But it was like, it took a little bit of time for me to feel like he's not going to think I'm crazy.
Uh, Courtney, thank you for sharing. That is an everyday occurrence at the Motherhood Center. Every hour, every minute. That's so common. And you think you're alone and you think you're crazy and you think you can't tell your husband. I can't tell you. I'm like, have you told your husband? No, he'll think I'm crazy. It's just all day long. And that can happen whether there's true psychiatric illness or not. So even people who have nothing cooking, right? They have other problems because no one gets away with nothing, right? With not having anything. But, in all comers without bona fide illness, you can have intrusive, violent thoughts. Like if I go near the balcony, I'm going to throw my kid off. If I see the microwave, I'm going to put my baby in the microwave, or that knife is going to jump out, like knives. That is not uncommon. Now, what makes it, there is a line. Okay, so the line has to do with how much, how often, how intense, how how much time it's taking in your day, how much distress it's causing, and how much dysfunction results from it. Okay. Then we're talking disorder, right? Like on the other side of the line. But by the way, there's a lot of mild of this that keeps you from, like, what if you couldn't go to work because you had to drive over that bridge? Now we got problems, right? So, like, or what if you can't fly because you work in a field where you're required to do so? So that's how people come to attention. And then thank God there are like certain boundaries but some people just, I have one patient who never got, I remember getting called, she didn't get any prenatal care because she had panic disorder with agoraphobia. She couldn't go outside, didn't get prenatal care. Like the amount of things that happen when there's untreated illness. So PS, from psychosis, from the most mild anxiety to true postpartum psychosis, which is a medical emergency, this is all treatable. Like headline. It's not even hard to treat. The hard part is coming to attention. It's how do we educate? How do we have people not feel embarrassed? I mean, Courtney, you just said it all. It's like, how do you have people share? You know, very few people have a village. And even if they have a village, they're not going to expose themselves in the village because the bottom line, and it's worse for women and people, birthing people of color, is they're going to take my kids away. Everybody has that feeling. I can't tell my pediatrician. I don't tell the truth on the screens that they give me. I can't risk it. And so you suffer in silence. So the big problem is not treatment. So I have created this treatment facility in the center of New York City. Our goal is to be everywhere. We're about to open in New Jersey and then Connecticut. The idea is this is anywhere and everywhere and all the time, whatever that movie title was. That's it. All the time. The problem is, and I don't want to put the onus on the woman who's experiencing it. So what can partners and others do? Well, I say to the woman or the person feeling it, or to the people, the residents I teach, the OBGYNs and the psychiatrists, I say to them and to everybody, if you see something's wrong or you don't think something's right, or if the person thinks something's off, or it's like if you see something, say something. Like, do not take no for an answer. Don't let anyone tell you you're fine when you're not fine. And that really, again, it does come back to the onus is on the person, but don't take no for an answer. We're dum-dums too, right? Like we're going to miss it. If you don't like, maybe the question, and doctors don't like to be wrong. So they're not going to ask or not know. So they're not going to ask you a question they don't know the answer to. But really, they don't have to know. You just have to know something's wrong and you get somebody to help. Like, I don't pretend to know anything about anything other than my field. If someone says it's a cardiac issue, I'm like, let me hook you up with if it's a this, if it's a that, I know someone, or I can find someone. But I stay in my lane, but it's not that hard of a lane if you just ask the question like, how are you? Like, really, how are you? Look somebody in the eye. I always say to the medical students, I say, you don't have to know anything. Look that patient in the eye and say, and hold their gaze in a very, like, what feels like a socially inappropriate way and say, how are you? Stare them down. And usually they start crying, either because you're so weird or because they really think like they're willing to, like, they can feel your concern. And if we could all just ask that question for real, then our job is just, you can Google it. You can find where to go. But like, it's getting to treatment. Treating these things is not hard. Okay, I could go on and on, as you see, but.
Okay, we're going to jump into some questions from the chat. If you have any questions, please share them, and let's try to be a little snappy so we can get to everyone. So this was from Krista. She says, questions for panelists. Any thoughts on how to manage in-laws or parents of the new parents who may want to help, but that help may look or feel like entertaining themselves with the baby, inviting themselves over, and having expectations of the new parents to share the baby time. All of this will result in actually undermining the relationship of the new baby with the new parents. What conversations can happen pre-baby to help share boundaries and expectations?
I mean, I always tell parents, like, look, you got to be honest, and sometimes there's boundaries, right? And so you have to be able to have the conversation. If it's your parents, you maybe have the conversation. If it's your partner or spouse's parents, maybe they have the conversation. If they're not comfortable, it's like somebody has to be comfortable enough to have the conversation to set the expectations, right? We will be seeing guests after the first few days. Mom and baby just went through a big transition, and we as new parents are adjusting, and we hope that you respect that, right? We will not be seeing anyone at the hospital. We are not permitted to have guests at the hospital. They don't know that. You know what I mean? Like you can kind of set up the boundary, but you have to stand up for yourself and for this new family that you will fight fiercely for, right? And so, there's an aspect of healing, obviously, that a mother has to do, whether it's a cesarean or a vaginal birth. Like there's a lot that's happening for a father too, who's welcoming this new child in. That's a bit of a different emotional experience for them. And there's anxiety and mood disorders on the male side too, right? So not just for the parent, I think it's setting the boundaries and being confident and comfortable enough to have that conversation before and not let anyone push the boundary on that. I mean, we talked a lot about not letting people come near the kids if they weren't properly vaccinated, which I know is a touchy subject, but for us, we were like, you need to have, and I forget what the guidelines were at the time, but it was like, whooping cough and things of that nature. Like you have to be vaccinated and otherwise you're not welcome to come near the baby right away, right? And my aunt wanted to be in the delivery room and stuff. And it was just like, whoa, like, okay, there's a lot happening here. But you have to just have boundaries and be able to stand up for yourself and do it from a place of expecting versus being vulnerable postpartum. I feel like where it's a little easier to be bulldozed, in my opinion, having gone through it, and be firm in those boundaries. And if they don't like it, too bad. This is the start where you become sort of the mama bear of this is my family and this is what I want you to respect our wishes and this is what our wishes are. And if you want to help in this way, here's how you can do so, and just being matter of fact about that. And doing it in a way that's not confrontational. Like, look, I'm nervous about what to expect, and I need you to respect my boundaries as I get comfortable with this new child and adjust to bringing a baby home. And I appreciate your willingness to accept that. You know.
Well said. And if everyone could do it that well, there'd be no problems because you're good at it. You're good at it. Like you say it really, really well, Courtney. And I think what I find is that people are scared of their parents. They're vulnerable. They've never been that direct. Their mothers controlled everything. Like there are all sorts of family dynamics that leave you in a position to be like, I've never really been in charge. Like I feel like a kid having a kid. My mother runs the show, or my father runs the show, or they tell me what to do, or I'm dependent on them for money or whatever it is. So I can't say no. Like there are all these things that are complications that come up. So, it's going to happen. That still, I vote everything you said is right. That if you can have those boundaries and be able to say, I know you want to be in the room, but we really want to be our new family in the room. Like kudos. If you can talk about it beforehand, I think that's where you do the best, where you
Yeah.
want to be on the same page with your partner. Because I mean, we talk a lot about in the book, in the book that we wrote, because there are a million scenarios and I've seen so many different things happen. I'm just flabbergasted. So you want to be on the same page. You want to bring it up early. What do we want? And if you're doing it on your own, what do I want? And it can be very hard to answer those questions. But the clearer you are, the clearer you can be with boundaries to say, here's what I want, or I don't want you to come in right away, or we're not having visitors for the first 2 weeks. I know you're miserable about that. It's not, and the subtext is, it's not your baby. I have a friend now who says to me, well, my mom still thinks it's her baby. Her kids are, grown children. And she's like, I don't have a say. I'm like, well, that's on you, honey. Right. Like that's her relationship with her mother. But like, it's a moment of like true reckoning. That's part of the identity shift. And it might not happen right away. And you might have made mistakes and let everyone and their brother in the delivery room because they wanted to be. Okay. I mean, like you would do it differently the next time. You do your best, but boundaries can be hard to have if you've never had them. So thinking about it, getting into therapy, talking to someone, asking friends how they did it, really important to find out what you want and try to go for it. And you can really ruffle feathers. And you know what? Okay.
And I think it's important to your point because sometimes a husband and a wife or a spouse and a partner or whatever are on different pages with that, And so I think to your point, doing it when you're pregnant to say, this is my wish, if these are your wishes, or let's both make a list. And then where can we compromise on it? They're adult conversations and they're not easy to have,
Yeah.
but you have to have them because if you don't have the boundaries, then you end up resentful and it spirals. So do yourself a favor and start now with the lists, you know what I mean? And try to talk through it in a capacity where, there's not as much emotion, where it's more matter of fact of like, this is what I want, this is what you want, where can we compromise? Okay, we'll see guests on this day from these times, and that's the best we're gonna do. So you can kind of, again, it's boundaries, right? It's boundaries with 4-year-olds who want to come into your bed at night if you don't want them in there. And it's boundaries with parents who are 45 years old or whatever that try to balance that. Or Cameron Diaz, who's like 53 and just had a baby last week. So good for her.
Okay, Marguerite asks, what is helpful for mothers who dislike their role, but are not a danger to the child?
Well, first of all, Marguerite, kudos for saying it. Okay. Not everybody likes their role, period. And sometimes that is in relation to your kid. And so I think that it's very complicated. Again, I think if it gets to a point, which you're saying it's not, of danger or, you want to put a kid up for adoption. I mean, those are your prerogatives. Okay. But I would always say that figuring out what's happening for you is essential. And what I mean by that is get thee to therapy, right? Understand, and maybe you're already in. So again, I don't mean to, I don't know anything, but what I would say is, I think it's really trying to understand what that means. Was it a desire? Often I see desired pregnancies, couldn't wait, and then miserable. And so something's changed, right? So what changed? Sometimes it's unwellness. So, I've had patients who wanted to terminate IVF pregnancies, and I say to them, but we look at your history. What this tells me is you're not well enough to make that decision. Okay, so I use that as in a way of an analogy. Like, what's going on? What would it mean to like? What is it that's making the dislike? How are you managing that? But really, it's like, how does one understand themselves vis-a-vis this new role so that you can get to a place of peace? Now, we don't always like what we get or we have, and that may be a reality, but what are we going to do with that? And I think you need to figure that out because mostly babies or children are not returnable. And you want to be able to be as well, to parent them as well as possible. So what does that mean? But that's a very brave question. So I appreciate it. And I wish you, if it's you or a friend, I don't know, but like in really digging deep to understand and also treating any illness that may be there, because I really hold to this idea that sometimes it's untreated illness that you didn't know was there that is in your way.
Mm.
So,
Let's do
you know, yeah.
I'm going to do one more question from the Q&A, and then I think we're going to have to say thank you and goodbye. I'm struggling with getting my 2-year-old to sleep independently. Our home is a small space, and our 7 and 2-year-old share a room. Another monkey wrench, my husband travels for work and is only home on the weekends. So sometimes it feels easier to just train it all so we can all sleep. We have a solid ready for bed routine, but he just wants mama. Any suggestions?
So it is boundaries, right? And I will tell you, changing a 2-year-old sleep is not sleep training. Okay. They know how to sleep. Okay. So I think there's a lot of people that are like, oh, I sleep train a 2-year-old. Well, you're not, I mean, to a degree, they have to learn the skill, right? But most 2-year-olds have the skill to do it. They have the preference to get in your bed or to come or to want the cuddles. And there's nothing wrong with that, but it's a boundary around how you offer it. Right. And it's a little bit to get into today, but I'm happy to chat with you if you want to set up some time to talk about it. And I can share some resources with you to get you started. But when it comes down to it, you have to think about it like, what are you allowing, right? If the child wants to get in bed with you and co-sleep, right? Which is a big common problem at that age, or is waking at night and wants you to be next to them and such, but it's disrupting now the 7-year-old. It's like, all right, well, you're welcome in our room, but maybe on the floor on a sleeping bag. You're not welcome in our bed. That's my space. And sometimes the reward is greater than the consequence, if that makes sense, right? And so I use the analogy of fruit striped gum. So for those of you, I'm 45. So for those of you that have had fruit striped gum in your life, when you first chew it, it's really fruity, right? And I often say toddlers are kind of like fruit striped gum. Like if they want an extra book, you give it to them a different popsicle. They want to sleep with you or whatever, and it's like a piece of gum, and you get the tattoo, and it's red and orange and yellow, and you get all these great colors, and it tastes amazing, right? Well, what does fruit striped gum taste like after 5 minutes? Cardboard. What do? Spit it out. And that's the same answer for every one of the clients that I use that analogy for, because at 2 years old, again, there's often some attachment, right? And they want to feel those things. You have to make sure you're filling their cup appropriately, that their sleep is balanced in the day, but that you have boundaries set up around what's acceptable in the home and what's not. Enforcing that boundary is where often parents are like, I'm just so tired. My husband is traveling. It's 2 a.m. Just get in bed, because it's the path of least resistance. But I will tell you, it takes about a week to fix with consistency in what you're doing. And the right setup to that success, and also avoiding overtired, which can trigger things to be much worse for kids, especially at that age. If they get overtired, it makes it a much harder bedtime, much more frequent night wakings, and things of that nature, to try to balance. So it's often more of a behavior shift from a parent perspective, understanding why the behaviors are happening, right? And then the implementation of it takes about a week to make those adjustments, and being able to do it at a point in which you can say, I have a week to dedicate to being consistent to make the changes. And, you can generally be probably about 95% of the way where you want to be.
Wonderful. Well, this is our time. You can find also a thank you to Katrina from the Motherhood Center team and to Dominique from the ParentCo team for helping make the magic happen. Katrina has dropped links to stay in touch with all of us in the chat. So we hope this is just the start. We hope this conversation continues. My email is hannah.howard@parent.com. Always happy to chat more. And thank you so much for being here today. Thank you, Courtney and Catherine. We're so lucky to have you, and we're grateful for this wonderful conversation.
It was fun. Thanks for having me. And great.
Thank you.
Bye.